C'est moi qui appuie dessus? Je sais pas. OK, on est bon?
Super. Super. So I can see you both. Recording is fine. I would just
or mute, and you cannot unmute yourself, but we definitely recommend you when you have questions to use the Q&A section where you can drop any questions that you might have, and we'll pick it up either throughout the webinar or later at the end. So there will certainly be time to answer questions. Great. So I think people have joined, and we can start get into the topic. It's great to have so many here of you of the Small World community, and to have you together. Quickly about us and who we are. So it's Marie, my colleague, and myself, Kevin, from the SIP Medical Family Office. We're specialized in international health protection and health management, especially for global citizens. And that's what we want to have a quick conversation or chat with you about tonight, and share some of our insights and tips and tricks specifically for global citizens as you are. Maybe to start with, it would be very helpful if you could send into the chat where you're from, or where you're currently dialing in, because then we might be able to address some very specific topics or locations from where you're dialing, which would be very interesting. And we will start now by going through a couple of destinations and locations that are for sure very high on your travel list or maybe relocation list, and share some practical insights on them. And whenever you have questions or you have specific locations to be addressed, let's go into that afterwards in the Q&A section. That's most welcome.
So hello everybody. So I'm going to take over from now on until Kevin finishes the rest of the presentation. So my name is Marie. So happy to see you here. And as Kevin has mentioned, we're just going to go through some tips and advice on some very key locations where we see a lot of global citizens getting set up or relocating to. And one very trendy destination at the moment is Dubai. It's called Influencer Haven. It's also quite incentive when it comes to tax and the modernity, the technology that they are able to put out there makes it a very attractive location. And we might even have some of you based in Dubai. So again, let us know where you are from. Where you living, where you are connecting from at the moment. It's very interesting for us to see where the members are located. So what you need to know about Dubai when it comes to health protection and in general the healthcare system, it's as many things in Dubai, even though there's a lot of freedom, it's also a very highly regulated insurance market. The DHA, which is the Dubai Health Authority, makes it mandatory for anyone who lives in Dubai to be covered with a certain level of benefits. So the compliance when it comes to health insurance and other financial services is very, very high. But also Dubai has an extremely rapidly growing healthcare system where you can have access to the most advanced medical treatment, which makes the cost of healthcare very, very expensive. Hence the need to have a good protection that's going to fill your needs. So if any of you are planning to relocate to Dubai, or if you're already there, I think it's worth also checking how you are covered and see if there is anything that you would like to improve and maybe discuss with your advisor. So that's it for Dubai. Then we're going to go to the next destination, which could be also a place where some of you are based. And that's the UK. And I'm going to let Kevin actually go through that.
Yes, actually one of my favorite destinations in the UK, especially because it has such a great social life and nightlife as well. And obviously for business also a lot of opportunities out there right now because of Brexit that has happened and what is going on there. So it's certainly a very attractive destination for travels, but also for relocations and setting up your residency there. When it comes to health and health insurance, there is though a couple of things to be considered because probably you've heard a bit in the news maybe as well that the NHS, the local healthcare system in the UK that used to have a famous reputation for its quality has kind of dropped a bit in the confidence of the public. So at the moment, it's actually on one of the lowest confidence levels of the public since many years. And that's partly because it's very very overcrowded healthcare system, and it's a bit exhausted when it comes to the resources that are available. So it's not rare that you would need to wait for a GP appointment or a physiotherapy appointment for several weeks, which makes it very complicated to get medical care when you actually need it. And so it's also expected in the next couple of months, and specifically post-COVID, that there will be a massive rise in, for example, cancer diagnosis because of a lot of routine tests and checkups, and cancer preventive screenings were postponed during the COVID phase because there were no resources available. And during those times, simply those diagnoses and symptoms were not checked. And very interestingly, but very important fact is that actually when you postpone a cancer surgery by a month, your risk of death increases by up to 8%, which is incredible because not only routine care was postponed during COVID phase in the UK, but sometimes also really essential medical care. So that's why it's probably really worthwhile if you're looking at the UK as your next destination to make sure that you have access to the private healthcare system where you can circumvent quite a lot of that, not everything, but you will have much better access to medical care when it's needed. And I see here a question, what do you mean easy access in case of evacuation? So let me quickly share a bit on that. The UK, or specifically London, is a very popular destination from all across Europe, but also Africa, when you need a medical evacuation for an emergency, because they have a really high level of healthcare in certain clinics. Some of the worldwide most famous clinics are home in London specifically. And because geographically as well, how the airports are available in London, it's just made or become very famous for evacuations and also repatriations when someone needs emergency care and can't get that medical care anywhere else, or at the current place where you find yourself from where you actually need evacuation from. So I hope this answers the question. If not, then please let us know.
So now I'm going to take you to another lovely destination. Hopefully you all had the chance to enjoy a stay in Monaco, if not longer. So Monaco, it's really all about the Riviera lifestyle. The French Riviera is a very famous location for holidays, but also for sports athletes, for entrepreneurs who want to really experience this lifestyle that we know in Monaco. So not only it is considered as a tax haven, so it makes sense for some people to be permanent resident in Monaco when it's about tax. but it's also a very international population with a true French feeling. So it's a very attractive to a lot of different nationalities, and you pretty much have everything you need there. What's interesting about Monaco is there's a really high quality level of medical providers. So you have the hospital, the Princess Grace Hospital. Worldwide, it is very, very famous for anyone to try to go into this hospital for some cares. But also what you will find there is there's a strong social security system because it's very linked to the French social security, which has a lot of good advantages. Monaco really has a social security that allows any permanent resident to have access to extremely good quality providers. This has its limitations though. If you're planning to have your treatments abroad, or if you do travel in and out of Monaco, sometimes it's important to check how your local cover offered by the local insurers there, or the protection providers, because it might be missing, there might be some gaps in the covers that you might find. But locally, the system works, and this is also why some people like to relocate to Monaco, is to really have access to the best of the best in Europe. So yeah, that's Monaco, lovely place.
And Malta is another a very high up destination for a lot of global citizens and also investment migrants, because it offers a very famous investment migration program, but also a global nomad visa program, which is interesting to stay on this lovely island. When it comes to healthcare, they have a solid local healthcare setup, so that's definitely nice. But it might be a bit too limited when it comes to complex care and high precision medicine. So for more complex surgeries and treatments, if you're based in Malta, you might want to have access to other places, such as, for example, France or Switzerland or the UK, to make sure that you're in the best hands when you need medical care. They also have a good local private insurance offering, but there it's really important to understand that Malta has a much lower healthcare cost compared to the whole of continental Europe, which is why very often you would also see on even international policies from Malta that they would only cover up to reasonable expenses on a Malta standard. And so if you were to go for medical care in the UK or in Switzerland with such a policy, you would clearly have to pay on top of that, because the costs will be 2, 3, or 4 times as high compared to in Malta locally. And also, a lot of the international policies still have restrictions in terms of their overall limit, so that's something to be considered. The industry standard of saying for global citizens is actually that your private insurance should not be lower than $1 million of coverage. That's really important, so that you can really access and benefit from the best healthcare when you need it, and you're not restricted to the country where you're currently resident, because it might not simply offer the best quality of care that you're needing. So that's something to be kept in mind when you're relocating to Malta, and when you're also deciding on whether you want to have local health insurance, state health insurance, private, or even private international health insurance.
Then we have Switzerland, guys. So Kevin and I are lucky to live in Switzerland. We are based in Zurich. It's a lovely country again. I mean, everywhere, all the destinations that we are mentioning are all worth visiting or even relocating to. What's very, very enjoyable in Switzerland is the safety and the fact that it's such a stable country. It is a stable country, but it also attracts a lot of international residents. So it's just really booming in some cities. You have a lot of startups getting set up here. So you kind of have the best of both worlds when it comes to Switzerland. Is you get a very nice lifestyle, but still get this modern feel and innovative mentality that you rarely find in other places. What you need to know about Switzerland is there is quite a strong mandatory local health insurance system. So anyone who is permanently based in Switzerland will need to have a local health cover from a local health insurer. So an international insurer will not meet the criteria as required by the health authority. This can be, of course, top up with any international cover if you do travel a lot. But the good thing about Switzerland is you do have a very high level of medical care. It is, unfortunately, the second most expensive healthcare system, but that means for anyone who has access to the system is that you have hardly any waiting time. So you can see a doctor, a specialist, within 24 hours, you will get an appointment. You don't have to wait for weeks or months, sometimes like we've seen in France, Italy, or in the UK. The system works really well. And you have access to extremely experienced specialists and doctors in general. For those who do travel a lot, even though you have the basic insurance, I think it's quite important to know that there are some limited insurance options for temporary residents or for people who will set up in Switzerland just for a few years, but already know that they will be leaving. There are agreements between local providers like Suica, who will have an agreement with Globality, which is an international provider. We also find Allianz working with KPT, which is another local insurance. So there are options. But they're quite limited, and this is why it's important to really understand and plan ahead for how long you're going to be staying in Switzerland, in which canton you're going to be based at. This will also have an impact. So there's many things to keep in mind when you set up in Switzerland. But once you're there, it's a beautiful country, and a lot of expats think they're going to stay only a few years, and they might end up just spending their whole life here and having kids and grandkids being born in Switzerland. So it's quite interesting. And then I'm going to finish up. So we've done a big around the world trip, and I'm going to take you to the US. We cannot not talk about the USA. It's still the American dream. A lot of people still see themselves there. There is a freedom to create startups, to develop companies, to really become the person we want to be. It's still there in the US. Some might say it's still considered as the only superpower in the world. We might agree or not, but there is still something special about the US. What you need to know, and you're probably aware of this, is the United States are just the most expensive healthcare system in the world. Switzerland will be expensive, Singapore will be, but there's just another level when it comes to the United States. A few years ago, President Obama tried to put something in place to kind of give access to healthcare to the majority and try to fix the, let's say, the discrepancies that some people will face when it comes to having access to a good doctor or to a hospital. But there's still a dilemma because the federal law will differ from the state laws. Depending on who is in power in the White House, Obamacare will be applied or not. So it just creates a lot of complications, and it's very important for you, if you are planning to relocate to the US, or if you're already there, it's very important to understand what happens on the state level and what could happen on the federal level at the next election. So this is very political. It's a little bit of a business. The healthcare is just another way for some people to make money. So you also have to be very careful who you trust and who you want to see. But no matter all these difficulties, it's also one and pretty still the most advanced place to get the latest treatments. They are very, very innovative when it comes to cancer treatment. They also are able to attract the best surgeons, the best doctors in the world. They are currently the leader in longevity research. So longevity is something that you should maybe get interested in, because it's really the new way of looking at health, is how can we make sure people will live longer, healthier. And there's a lot of research happening in the US at the moment about this topic. So lots of good things in the US, but it's also a place where everyone has to be careful and trust who they're going to be giving their health to look after. So this is about the US. And then to finish off on that, we just wanted to give you just a few simple tips about what you need to think about when you are going to travel to one of those countries or to another one. It might sound a little bit simple and silly for most of you, most likely, but it's always good to remind everyone on how important it is to check your cover before you travel. It's personal travel or professional travel, it doesn't matter. Just make sure you know what to do in case something happens. It's very, very important. We've seen so many people just leaving to another country, not realizing the cost of an evacuation or repatriation. This is hundreds and thousands of dollars if we need to go pick you up on an island to bring you to a hospital in Thailand or Singapore. So just make sure you check your insurance cover if you have. And if you don't, of course, make sure you talk to a professional to organize that. On the opposite, we also feel like a lot of people are over-insured when it comes to travel insurance. So your credit card, the provider who's going to help you to book your trip is probably going to offer you a cover. You probably have something through your work. You probably have your own personal travel insurance in place. So don't over-insure yourself. There's no point, but make sure that you know what's covered and don't forget about anything. And there's a clear example 2 years ago, before the COVID crisis, pretty much all travel insurance were not covering for any treatment related to an epidemic or pandemic. So clearly this has changed, but it's always good to check the benefits and to make sure, well, COVID is covered. It should be now. Most insurers have made that move, but you never know what else can happen. So always keep your cover up to date and talk to a professional about it. It's also very important to not rely too much on the local healthcare system. It can be very frustrating if you have to wait hours and hours in a local hospital. So make sure you have the ability to go see a private doctor. So it's coming back to checking your benefits with your insurance. What would be covered, what is not. Have your medical records available. So it's so simple, but make sure you have easy access to any medical history. If you are taking any treatments, make sure you know exactly what it is, so you can really refer to the medical doctor if something happens. And the last point is about emergency kit. So again, here it's about anticipating and being ready for the worst, so you can really enjoy your holidays in case something happens. It could be just having a small pharmacy kit with you. Of course, your medical records, we just talked about that. It's about knowing where to find the local emergency center, where to find the nearest GP in case something happens. And there's something also that we really advise, and we're going to show you on camera. It's what we call the ID Know. So Kevin has a little bracelet. Kevin, if you want to show it. Yeah, perfect. So ID SOS, and I have a different one. So it's on my watch here, and you can see it's a little QR code. So you can put it on your watch, you can put it on your helmet if you like to do road biking. You can have the bracelet like Kevin. It can just be a simple card in your wallet. And what the emergency team will do if something happens to you, they're going to scan this code, and they're going to have a very quick access to your personal data. And that's going to be, what do we have, Kevin, on this? I don't know, there's so many things.
So it's really the most essential things that you need to have. So not a comprehensive medical data insights, because we don't want to, we want to protect our data from being accessed just randomly. But knowing the identification of having your picture there, knowing your blood type, knowing your whether you have any allergies or you have severe pre-existing conditions, or whether you have certain drugs that you could not take because of some intolerances that could simply make a difference between life and death. So it's a really small device, and you can easily shop it online. By the way, we're not getting commission for that. We just think it's a very helpful thing to have. And it costs probably somewhere in between 10 and 20 euros, but it's really worthwhile having a look at it.
Perfect, good. So yeah, here's some travel tips for all of you. Yeah, just have a read through, anticipate your next travel, and see if you're kind of going through that checklist in a positive way. And if not, then you know what to do.
So overall, what we see or observe a bit, what global citizens especially are confronted with or struggle with is generally there is such a massive information asymmetry in medicine, like unlike probably like you see it in finance or in legal or any other type of really important area in your life. And what we see in most of those areas, like finance, like insurance, for example, those types of care or those types of businesses, you would always have an expert who is advising you, an independent intermediary that is helping you and protects your interests. But very much to our surprise, not in medicine. Because you will always speak directly to the doctor. In, I would say, 95% of cases, you have no intermediary in between who is helping you to protect actually your interest, and someone who is specialized and has certain knowledge to have a conversation around what medical treatment is right for you and what might be not. And be very clear about it in every hospital where you go, and also depending on your insurance, the hospital and the doctor, they will also decide what type of care you will receive depending on what insurance policy you're holding. And that's not really an argument so much for also having private insurance, because what we see a lot as well, and where you need to be careful when you have private insurance, you tend to be overtreated. Hospitals and doctors tend to overprescribe, whether it's on medical checks or whether it's on drugs, or staying for another 2 or 3 days longer than actually necessary in the hospital. And this all comes with risk. So while definitely it's a good idea to have a private insurance for various reasons that were mentioned, be also cautious when you go to the hospital, also abroad, where you might not be familiar with the healthcare system, that you're not oversold, and that you're not taking any risks that could be avoided in terms of unnecessary treatment or unnecessary care. And there it really comes down to, as an individual, it's absolutely impossible to know globally where to go and whom to approach when you have a medical issue. And this comes with a problem of trust, because very often with different types of businesses, you can test where you want to go for your vacation or your next relocation. You can test which investments you want to make, and all sorts of stuff. But with medicine and health, it's usually a one-way road. So if there is a wrong treatment, if there is a wrong surgery, there's very often no way back. That's why it's just so important that before you act, you really know that you can trust a person and make it in a trusted environment. And as said, luckily, actually, all of us are not personally going through that much health misery or health critical situations that we become the experts and know whom to approach when we have an oncology issue or a cardiology issue, and who is a trusted person with the right work ethics. And that's just what makes this so important, but also difficult to manage because you very often only got one chance. And so there's kind of a couple of key takeaways that you can take from here and general advice, possibly some tips and tricks that each of you could implement as of tomorrow already. When it comes to your health protection in terms of insurance, the health insurance world is really a jungle. It's crazy. You will find that many different offers that are so much different depending on whether you're in Asia, whether you're in the US or in Europe, or in specific countries on those continents. Also because the healthcare systems are very different. So make sure that you understand how this really works before you make a decision, and make an educated decision. And the most essential for a community like a small world of global citizens and frequent travelers is probably the international continuity of your medical insurance. Because with most local private or local state insurances, you would automatically lose this health insurance as soon as you relocate to a next location. And that's really where you experience then the first issues when you have such a relocation ahead. Because if you have had some health conditions in the past, you'll be excluded from private insurance for those conditions. And this will be probably a self-pay condition for the rest of your life. So in the optimal scenario, in the optimal case, I would say you select your health insurance once in a lifetime, and you select one that you can stick with for a lifetime, because that's usually the situation or the setup with which you will run into the least issues, even if you think ahead of retirement or your next job somewhere abroad. You want to make sure that you keep having the health insurance that you actually would like to have. And for those of you that have different residencies even, or multi-residence, a small trick that is often forgotten or overseen is compare the premiums between the different locations. As an example, if you might have an apartment in Malta and you might have another apartment in the UK, you would probably pay in the UK around 50 to 100% more in premium for absolutely the same benefits. So if you have that possibility, don't waste your money and make sure that you invest it with the right setup, because you want to avoid certain insurance taxes. You want to avoid possibly locations that are very high in healthcare costs and health insurance premiums, if you obviously can and you have that option. And when it comes to healthcare and during your travels or early relocations, before you have arranged your network and you found the people and the doctors that you trust and you go to, orientate yourself with the international clinics, because they typically have a service level that is on an international standard. So you know more or less what to expect, and there are hopefully no unpleasant surprises. And they also know how to work with international health insurance companies, which can remove a big time effort or hassle from your to-do list during vacation or early relocation. And the second, and that's really an important piece of advice, probably the most or the biggest source of medical mistreatments or wrong treatments is coming because people are not considering or looking at a second medical opinion. and are blindly trusting a first recommendation that they get from a doctor. Every doctor, no matter how much he works in your interest, will have only a limited knowledge and will not be able to know everything in his field, and might be able to forget or oversee something. So whenever you have something coming up that is more severe in terms of treatment, or absolutely with surgery, get a second medical opinion, get possibly a third medical opinion, and get it outside the healthcare system where you got the first opinion, to make sure that you really have a differentiated view on that, so you can take an educated decision on how you actually want to take care of this medical issue or of this health issue. And plan ahead. Make sure that you know your priorities. What are your plans in terms of your health, your priorities, etc., and start thinking strategically about your health. That's especially important when you are a global citizen and you're changing from different environments over the course of your life. And I know those are some practical, maybe minor details or tips that everyone can really immediately apply. If you're not feeling comfortable with that, really go and get professional advice. What most people don't understand or don't realize, that with insurance, this advice is always, or most of times, free of charge. So if you're going to a broker, this broker, insurance broker, will never charge you an additional fee for his services, but you still can benefit from his or her expertise and experience, which is absolutely worthwhile, considering that it's coming at no cost for you. And yes, kind of a funny picture, but also not that funny, because very often it reflects also reality. And I'm sure some of you have experienced that within their family environment, or possibly even by yourself. Depending on where you go and who you speak to, you could have very, very different opinions and recommendations from doctors. So just a general advice, it's very good to have a reasonable level of doubt with every medical appointment. Don't blindly trust a medical authority. Make up your own opinion, and also make sure that you do not only rely on a single individual person, whether it's at your home country or whether it's abroad. It applies in the same way. And that was it from our side for tonight with our inputs. And we will be open now for a couple of questions. I think we still have a few minutes. Maybe we can check what we have, if we have anything in the Q&A section. Yeah. But you're now most welcome to type anything that you might wonder into the Q&A section. And if it's also maybe something a bit more delicate or personal, which we understand very often happens, especially when it comes to health, write us a text. We're more than happy to take time and have just a casual conversation around a personal topic. That is most welcome.
So Kevin, we have a question from Lisa. It's about the European health insurance. Actually, that's a very good point, Lisa. So she's asking if it still works for the UK and Switzerland, and is it a good insurance? So 3 answers. So Switzerland, nothing has changed. The European health insurance still covers for Switzerland, no problem. For the UK, it is a little bit of a different story. So any cards or any cover that has been implemented pre-Brexit still covers you for treatment in the UK, and then for those who took the UK card in the European area, so this is no problem. But for any new applicants, they will have the choice to take also the UK as part of the cover or not. So it's with or without. So more or less, it's the same than what you used to, except now you have the choice to include the UK or not. And is it a good insurance? It's a very good question, and it's really hard to answer because a good insurance is really good when it meets your needs. It really depends on what benefits you're looking at. If you want to have access to private clinics and really have this freedom of choice, or if you just want to be able to see a doctor and get that medical visit reimbursed by your insurer. So the European health insurance works for many people. It's a popular solution that a lot of maybe younger people will tend to use. It's not for everyone. So again, it's going back to what Kevin said earlier. It's get a professional advice. Of course, we can help you, but many people can also advise you and kind of understand your need and tell you if it's a good insurance for you.
Wonderful, great. And I see we have another question here, who's asking, a friend of mine was just diagnosed with cancer. Where would you generally suggest him to get care? Okay, that's an interesting question that we actually get to see quite often, because cancer is such a huge topic really around the world. It obviously really depends on the individual situation and where this person is right now and what stage the cancer is, what has been performed already. But globally speaking, there are, I would say, 3 or 4 cancer specialist hubs around the world. If you're more in the Asian region, you would probably go to Singapore and want to see a Singaporean clinic. If you are more in Europe, then you could probably look at either Switzerland or the UK. And in the UK, there are actually some very interesting developments happening. There's a company called Percy Health. They started to really orchestrate a whole ecosystem around cancer care, because the traditional oncology care knows more or less 3 types of treatments, which is radiology, chemotherapy, or surgery. There is much more to it. So there is a natural path approach to it. There is a nutritional approach to it, which obviously those type of cares or supportive cares are not replacing traditional care, but it might be very well in considering that as support for your overall well-being while you're going through this type of care. But also psychological care when someone in your family or yourself, you're fighting with a cancer condition or received a cancer diagnosis. So that's something very interesting in the UK. It's called Percy Health, if you want to take note of that. And then what also Mari mentioned is probably the other hotspot where you want to go if you have a cancer condition and where you want to seek treatment is in the US. So those would typically be the destinations. And then obviously we need to slim down a bit on which clinics. And in the end, it really comes down to the doctor that is taking care of you and the oncology board around you. So also here, make sure that you're in good hands and possibly knock on more than just one door and get an opinion and get a review before you proceed and decide with what type of care you're going to proceed.
Great. And Kevin, I think we have one last question for you. Or I'm happy to answer it, you choose. So the member is asking, could you talk a bit about your business and which services you offer at SIP Medical Family Office?
You want to take it, Mari?
Sure. So SIP Medical Family Office, as we have mentioned, we are based in Switzerland, and we have kind of 2 lines of business. We are an insurance broker, so we offer international health insurance solutions to individuals, families, employees being sent abroad by the companies. We also do a lot of work for the diplomats in Switzerland. So as you know, there's a big population of diplomats here, so we take care of them as well. So any type of protection solutions, so life, health, income protection, kidnapping and ransom, we are able to find solutions for our global travelers. And then we have what we call the actual medical family office, which is really to manage the health of our clients the same way a family office will manage the wealth. So we really go into details into the health planning. We will organize checkups for you in private clinics. We will look at some of the diagnoses that you have received. We will make our panel of experts work on this, give a second or third opinion just to make sure you are getting perfect treatment. And it's not just about being reactive, it's about really taking you in a proactive way in managing your health. So it's also kind of deciding together with you, what is your priority? Do you want to live the longest possible? Do you want to be the healthiest and be the fittest person on the planet? And we will kind of target how you can achieve those goals with you. And then we have the whole concierge services around it. So what we can offer is if you go for a work trip and you go to maybe Iraq or Syria, so those really kind of difficult countries, risky countries, but there's still business opportunities to make. We will also make sure you are safe when you go there. We'll kind of take care of your safety and make sure if something happens, we are available to help. So 2 lines of businesses, insurance broker and medical family office.
Great. And I think that's probably a good end to it. I see we're clear on the questions as far as I see, and probably we've also reached the time. We don't want to keep you for too long. Please reach out. You're most welcome. The whole Small World community. We're more than happy to help you with any concerns or issues that you have, and just have a conversation around what question you have or what issue you have and how we might be able to help you, and whether we might be able not to help you. We might not be the right contact, but then we certainly would have a contact who could help you. So I think that's it from our end. Thank you very much for being here. It was a true pleasure, and we wish you a lovely rest of the day and lovely evening to all of you. Take care. Stay healthy. Bye-bye.